Yeah, so it's really exciting that New Zealand's planning a patient safety campaign, and we've been on that same journey in England, and we've learned some lessons, and it would be great to share them with you. So I guess lesson number one is that we tend to spend a lot of time debating what is it that we're going to work on, and why would we work on those things, and that's really, really important. I guess my learning is there's a couple of lessons. The first thing is actually not all things are equal in terms of their complexity. So my advice to you would be try and keep it really simple. The second thing is that you're never going to be able to include everything in a campaign. A campaign is about something that's very simple and can be delivered by a large number of people. So it's a high impact but direct programme of work. The third thing is really, I think, if you're going to run a campaign, you really need to understand how you're going to measure the change that you want to see and set some really clear goals about the direction of travel. And I think the reason for setting clear goals is that once you put that message out, then obviously that requires interpretation through your system, and you want everybody to really understand where they're headed for. So what's the destination? And the fourth thing is that we tend to spend a lot of time thinking about what is it that we're going to work on. Are we going to work on medication errors? Are we going to work on falls? And actually we spend less time working on how are we going to get this to happen. So what is the mechanism through which we will engage people? How are we going to understand where our experts are? How do we harvest the knowledge that's coming out of our programme? So how is it that we're going to understand what good looks like, and how do we replicate it? So I would suggest that anyone who's thinking of running a campaign thinks very carefully about how they manage knowledge and how they direct people to that expertise in a way that's helpful and adds value. And I think the most important thing that I would say about any campaign is have fun. It's about engaging with people. It's about the reason we came to do the work in the first place. It's about connecting with healthcare professionals and patients and the values that bind the society together just as much as it is about the topic areas. Celebrate the successes you have, really bring people together and create an energy for change that really is unstoppable beyond the end point of the campaign.